नमस्कार, सलाम, सत श्री अकाल, गुड इवनिंग। दोस्तों, आज फिर हम हाजिर हैं डॉक्टर सीमा पांडे टॉक शो नॉलेज थॉट्स के साथ। आज हम बात करने जा रहे हैं फर्टिलिटी प्रिजर्वेशन पे। A warm good evening to all my viewers and my darling friends. And here we are, we for myself, Dr. Seema Pandey, my co-moderator, Dr. Anuradha Khan, and our panelists, Dr. Arjun Kumar and Dr. Raj Lakshmi Wala Valkar, is trying to join, doing something which is making a lot of noise. It should not.
Sorry, I'm driving. I'm just about to park.
Please mute yourself. Friends, for last 2 days, we have
Dr.
been
Raj,
talking.
please mute yourself. Sound
Yeah.
will stop.
Friends, for last 2 days, we have been talking about the age, ovarian reserve, and how is it affecting the overall fertility of a woman. In continuation with this, and we have just witnessed that how with the changing demography, a woman is free. And she has the not only the financial freedom but also the emotional freedom of choosing what does work for her. And in that continuation, we are going to talk about fertility preservation. Fertility preservation is a very, very scientific word, which in plain English means by just procuring and freezing your eggs and your sperm, you keep your options alive and better for future childbearing if by any cause or any chance you miss it at the peak of your fertile window. In this continuation, fertility preservation is of two types. First, which is done for the people who are sadly suffering from some kind of disease or cancer, and they are undergoing kind of chemotherapy treatment or radiotherapy treatment, or people who have had some kind of accident, or even males having cancer. Before undergoing the treatment for that, when they preserve their fertility, that is fertility preservation. And women who are apart from cancers, if having premature ovarian failure or endometriosis, and their fertility is going to get disturbed in future, and for if for that purpose they are just storing their eggs, according to me that also comes under the heading of fertility preservation for medical causes. Apart from that, for this reason, if a woman, she is not able to find a right partner, she wants to pursue her career, she has some kind of family responsibility that she cannot have child just now, if she is freezing her eggs, that is called social egg freezing. To talk about that, apart from V4, we have a special guest, Dr. Indrani Lodh, who is busy somewhere and will be joining us soon. I will hand over this to Dr. Anuradha to just share her view further on fertility preservation here. Unmute yourself, please.
Good evening, everyone, and I welcome you all for today's session. Now, fertility preservation. What does it mean? As already Dr. Seema has told, that it is the process of saving or protecting the eggs, the sperm, or the reproductive tissue of a person so that it can be used later on to for them to have their own biological child. Now, fertility preservation came into vogue because all over the world and even in India, the incidence of cancer is on the rise. And cancer for people who are less than 40 years, they are also especially increasing. So, hence the necessity of, because cancer, as we all know, that the treatments are varied. In early cancers and all, surgeries are done. In little moderate cancers, they combine surgery with radio, with chemotherapy and or radiotherapy. And later stages, when it's very advanced, sometimes we are not able to do anything, and the damage has already occurred, and we give palliative therapy. So these are the basic things which we do. Now we have to understand that whenever it is not only in cancer patients that we need this fertility preservation, we have been discussing about the lifestyle changes which our overall uh, perspective has changed with regards to life, especially the youngsters. They're delaying the childbearing, they're delaying marriages. We have been discussing last 3 days. We'll not go into that detail, but supposing somebody wants to delay childbearing, but the biological clock does not work, the ovary will age. So, for them also, preserving their eggs would help them later to have a genetically related child. Now, another thing is, as Dr. Seema said, endometriosis is very common nowadays. The problem with endometriosis is that it affects the oocyte pool, whatever the ovaries. See, we are born with a fixed number of oocytes. A girl is born with fixed number, and we cannot replicate them, or we cannot create them. When the damage occurs and the pool decreases, it is permanent. So what we can do in severe endometriosis and all, where AMH is falling down and she's progressing from say mild to moderate and moderate to severe, there also, before the damage occurs, we can preserve their eggs and then they can have their own child. I would like to ask Dr. Raj, can you please add to the indication? So what we are talking about is where all we can do this fertility preservation. So can you elaborate on
So,
some more points?
so obviously we have medical causes and then we have social causes. Medical causes typically is going to be, I mean, you've just touched upon endometriosis. That's an excellent example of a medical. But let us talk about systemic diseases affecting your fertility. So typically a patient who's a diabetic, okay, or she's got maybe like a let's just stick with diabetes. That's like the best example at this minute. So we basically know that with diabetes, you are dealing with insulin resistance anyway. Diabetes causes a cellular damage at every organ. So the longer a diabetes stays, the more damage to your organ system. And we know this from diabetics ending up having cardiac problems, diabetics ending up having renal problems. Okay, and can you not hear me? I'm sorry.
Raj, you continue. I was asking Dr. Arshi to mute herself. Actually, our voices are echoing if all of us are not muting ourselves.
So basically, we know that ovarian aging tends to be a little quicker in diabetics as compared to non-diabetics for the same age, for the same AMH. And by aging, I don't mean actual aging, I mean the egg quality. The egg quality tends to be poorer. So people, women who are severe PCO, who are likely to be developing, type 2, women who are type 1 diabetics, who are like well controlled now, because with advances, type 1s do have a very full life. Type 1 is not as much as a taboo as otherwise. So maybe those are cases where one could think about women who suffered from tuberculosis before. Tuberculosis very typically would bring down general health status. That might be an indication. Obviously, the social need for oocyte freezing. So very typically, a girl who has not found the right partner, she wants to wait to get married, or a girl who says, "No, I'm like really brilliant. I want to complete my studies," and therefore she wants to postpone her childbearing. Um, in men, again, where you have low sperm, motility, low sperm parameters. Um, in fact, one of the main things that we can also typically women who have history of breast cancers in their family. risk of developing that later on does tend to be high. So even in this group, it might be worthwhile collecting some eggs and freezing them depending on what their genetic gene, testing shows. So these are extremely high risk. If at some point of time they are going to be recommended, so we all know Angelina Jolie chose to remove both her ovaries and chose to remove both her breasts. And very, very, luckily for her, she had finished her childbearing by the time she knew that she was very high risk. But not everybody would know that. So, typically if there is a history of breast cancer in the family or history of ovarian cancer in the family, this girl, when she's still young, she might go through a cycle and maybe, feed some eggs. Tomorrow, भगवान ना करे अगर ये कैंसर आ भी जाता है, तो एटलीस्ट कैंसर एंड अभी कैंसर से रिकवरी अच्छी हो रही, people are really surviving. People are having 20-30 years cancer free survival. तो वो 20-30 सालों में कैंसर अगर ओवरी में भी है, यूट्रस तो अच्छा है, बेबी कैरी तो कर पाएगी 9 मंथ के लिए. तो एट दिस टाइम अगर उसके ऑलरेडी एग निकाल के सेव कर चुके हैं, so from my point of view, na, any woman who is at a risk of any sort of a systemic disease could actually think proactively about saving her fertility. Either eggs if she's single, or if she's married, she's in a stable relationship, then maybe even creating embryos and keeping them. So yeah.
Yeah, Dr. Arshi, now we have got little idea about what fertility preservation, where we do. Now, there has been a guideline in all the oncological, societies, and especially our ASRM. There's an American guideline on fertility preservation. I would like to ask you, what is the most important part? A patient has been diagnosed as, say, breast cancer. Okay, so stage 2, say, supposing, and she is like 30 years and she doesn't have a child, she's married. So what is the most important point in when you talk to such patients, what will you tell them?
Consent counselings, that is initially what will be the outcome. You cannot guarantee the outcome after so many years what will be it, but you need to tell the importance that this is what max we can do, and before going to this has to be done because this will help you in future with all the possibilities which can come. So definitely consents and counseling, this is the first step. Then induction and yeah.
Okay, so the ASRM guideline says that whenever a patient is diagnosed in reproductive age group, is diagnosed with any kind of cancer which needs chemotherapy or radiotherapy, they have to be offered, it is mandatory to offer them fertility preservation. And there the counseling plays a very important part. This is the most important point. If we're able to convey to our doctors or our patients both, that we have to offer fertility preservation, and
That is a
then we
very
have
That is a very important point which Dr. Anuradha has risen. And adding to Dr. Raj Lakshmi's point, so according to her, all these systemic diseases and their impact on looking at their impact on our fertility, those should also be taken as medical causes for medical indications for fertility preservation. As of now, medical causes are covering only those diseases where we are providing any kind of cytotoxic, that means cell damage. Especially, you have to remember all these cytotoxic and radiotherapy, it
Chemo and
damages
radio both.
us dividing cells of the body, and our oocytes are one of such kind of tissue, one and that kind of cell. So and so is the sperm. So that is a very very genuine thing, and it should be included into that. Coming to the ASRM guideline, which states that every individual who is suffering from the cancer, who can just preserve their fertility or can preserve their genetic cell line, they should be offered that and that is very important. Coming back to that, Raj, in our country, all of us, we all four of us are in fertility specialists. We are doing reproductive medicine. Do you think our society, especially even doctors, be it oncologists, be it gynecologists, are they still that sensitized about the concept of sending a boy or a girl or a woman to a fertility specialist to protect their fertility for the future or to preserve their fertility?
No, I'm actually quite sad at the state of affairs as far as counseling for fertility preservation happens in India. You know, oncologists and oncosurgeons um, do counsel them about how well the field has advanced, do counsel them about disease-free interval, do counsel them about remission for years together. But at that point of time, they think only cancer. They don't think the patient. The patient, after he recovers or she recovers from cancer, has a life to lead. And that life is going to include, things like having a family, enjoying kids, um, you know, uh, everything that you and me might be taking for granted. Just like this, just like the mere joy of becoming a parent. And
Yes.
that is somewhere where I feel we as infertility specialists, whenever we come across an oncologist or an oncosurgeon, maybe we should start it on an individual level. वन ऑन वन बात कर ले कि बाबा ये होता है, आपके पेशेंट की जिंदगी कैंसर ठीक होने के बाद जारी रहने वाली है. And when they recover from cancer, allowing them to get pregnant, उनको उनकी fertility देना, उनकी life, उनकी family शुरू करना is also a positive step toward getting them to live a more fulfilling life. कैंसर आज फुल स्टॉप नहीं है. तो
बिल्कुल.
अगर ये बात अगर तो मैं एक्चुअली चाहती हूँ कि अपनी सोसाइटी को आई एम रियली होपिंग के जो मेरे डॉक्टर फ्रेंड्स आज सुन रहे हैं वो सीमा और अनु को वोट कर दे, बिकॉज इनसे मेरी एक डिमांड रहेगी. मैं रिक्वेस्ट भी नहीं करी हूँ, ये मेरी बेस्टीज है, तो मैं डिमांड कर सकती हूँ कि जब ये इसार के पोस्ट होल्डर्स बने तो ये प्लीज ऑन्कोलॉजी सोसाइटी ऑफ इंडिया के साथ बैठ के एक विचार विमर्श करें और ये बात कहीं पे इंडिया लेवल पर ये प्रॉपर एक एसओपी बना लो. बिकॉज
So, yes,
Raj, I
Anu,
have one
I,
important point.
Anu, before you make a point, I'll answer to Dr. Raj Lakshmi's question. 2 years back, when Dr. Jaideep Malhotra was president ESAR, she had made a special interest group called Fertility Preservation. I had the opportunity to co-chair that SIG with a very renowned fertility specialist from and who is working a lot in field of fertility preservation, Dr. Gunshila, to do that. And we tried to do some little work, and I promise you in future, whenever we get the opportunity, we'll be continuing them, those projects, because the reason is it's not about masses. Till date I have got 3 or 4 girls, thanks to our science, that the life cancer free has, and that lifespan is increasing. So this is our moral responsibility to, as you said, to give that joy to the couple, to the boy, to the girl, of feeling that procreation, as I always believe, comes from inside. चाहे आप एकदम लो लेवल पे झाड़ू पोछा करते हो या प्राइम मिनिस्टर बन जाएं, आपको पेरेंट बनने की जो इच्छा है वो अंदर से आती है, तो उसको फुलफिल करना हमारी मॉरल रिस्पॉन्सिबिलिटी है. तो हमें इस फील्ड में ज्यादा से ज्यादा काम करने की जरूरत है. ओवर टू यू, अनु.
So, see, there's something called as reproductive rights of a citizen of India or all over the world. Everyone has the right to, have a child, get pregnant, and take care of that child. So we cannot, हम उनको इस चीज से वंचित नहीं कर सकते. We have to give them that a chance. So, I am surprised that in 2006, American Society of Clinical Oncology, they first published the recommendations that before starting any cancer therapy, the oncologists have to explain that there could be infertility, post that therapy, whether it's chemo or radio. And they are supposed to take a proper consent, and they are supposed to do counseling, and the counseling has to be done by mental health special counselors, and also the counselors who are there in the oncology department, who you know take the patient, hold the patient's hand and take them through these therapies. So it has been recommended in 2006. And in India we do have Fertility Preservation Society of India, and Dr. Nalini Mahajan has done a lot of work on that. Dr. Madhuri Patil, a lot of people are associated with it. It's not that we have, but still there is a lacuna, there is a little bit, it's not the awareness, there is deficit in awareness as far as doctors and both our society is concerned. So I think more awareness programs, more NGOs, more societies have to come forward and put it across.
इसमें ना एक और एस्पेक्ट पर काम करने की बहुत ज्यादा जरूरत है, एंड दैट फैक्ट इज द फाइनेंशियल एस्पेक्ट ऑफ। आज कैंसर थेरेपीज आप इंश्योरेंस के अंडर कवर करते हो, लेकिन कैंसर वाला पेशेंट अगर फर्टिलिटी के लिए आता है तो उसका वो फर्टिलिटी प्रिजर्वेशन शुड आल्सो बी कंसिडर्ड टू बी पार्ट ऑफ द कैंसर थेरेपी, एंड दैट एंटायर थिंग शुड आल्सो बी कवर्ड, एंड वी हैव टू
Definitely.
स्ट्रांगली फॉर दिस पॉइंट। जब
That
ये
is an
हो जाता है,
excellent point, Raj, because at that point of time, that family, that couple is
Financial burden.
struggling with finances
absolutely,
to save the life, and this becomes an additional burden. So it is
absolutely.
very rightly said, and you were spot on regarding that. So going beyond that, Arshi, yes, Arshi, I was coming to you only.
Yeah. Seema, 25 years back, I started my career by starting as a locum in a radiotherapy department for time being. So there, patients were like in thousands, but there was not a single counselor, and nobody thought about fertility preservation. So till date, the same scenario is going on. These government departments, there is no specifications that a patient comes under this age. If she is in the fertile age group, she need to be counseled about it. उस time है ना, सारे लोगों का दिमाग कैंसर है. They are already overburdened, tensed, and they do not think about this reproductive aspect at that particular moment when they have active disease. And nobody, not even the doctor, not even anybody suggests them that what will happen. It is like tum jinda rahoge, ye rahoge. So the scenario which we have created in our country is totally not at all in favor of fertility preservation. उनके हिसाब से किसी को अपना बच्चा होना is not very important. लोग
That
Yeah.
is
अलग
their
तरह से
own
सोचते हैं.
perspective. They have to understand they cannot dictate someone else's life. And very sad but true. That's how we, the doctors, even think. We give the
Yes.
dictum. We tell them, no, this is not good for you. This is good for you. But this is their personal choices. India being considered as a third world country, it keeping the population in check and just treating the disease have always been the first line of focus. It has never come to their attention, but things are changing now, and people, they want to live a good quality of life, and they want to feel whatever they can. So we as a
Nowadays it is started
never
that
discourage
endometriosis
them.
line.
Yes, and even in endometriosis, till date, I've got 3 or 4 patients, and thanks to these younger generation who is like 2 decade, one
Aware.
decade younger than us, these people, these even doctors, and as well as patients, they are very, very aware, and they want to do things rightly. And I was sent 2 or 3 endometriosis patient. I got 2, 3 CA breast patients, but things had gone so out of control that treating them for fertility was next to impossible. So I just wish them good luck with adoption or something. But it felt sad. She was living 5 years disease free life, and she was absolutely fine. But she said that nobody has ever suggested. Coming back to our topic, Arshi, given a choice like a patient who has carcinoma breast, she has to undergo surgery or she has already completed her surgery and she is due for her chemotherapy. Now she comes to you and you have to advise what is the best way you want. What do you advise her to freeze? Whether her
uh, I will withhold her chemotherapy for a month or two. Already she had been operated. Maybe she can wait for initially
no,
also she
chemotherapy
was on.
cannot be withheld. You have 15-20 days.
We can do induction and we can harvest the eggs and freeze them. That is the easiest. Wherever she comes in, whichever part of the cycle, we can start with the induction and harvest the eggs and freeze them. And maybe from next cycle after harvestation, she can undergo chemotherapy in 15 days.
See,
That
one
This
is
is
point
what
what.
I have to make, that it is not only these chemotherapies and all, not only that apoptosis of the oocytes occurs and oocytes deplete in number, but even if they have, say, few oocytes left, aneuploidy is very common in these patients.
Yes.
So I mean, it is mandatory to freeze those normal euploid oocytes to have euploid embryos later on. Or
In
if
these,
married, we can make the embryos and freeze them. So it becomes easier. So that is
the,
why I want to just focus on this point, that not only decrease in oocyte number, um, aneuploidy. We have to keep that in mind.
there is one more way by which we can freeze the tissue, ovarian tissue also. If there is, the time does not permit that we can do induction or anything, we are not having time, so we can directly go take the tissue, ovarian tissue, and we can freeze that also, and in future we can reimplant it and then use it. So that
yes.
is.
That's what I wanted to tell Arshi. Even if this, and I agree to Dr. Anuradha's point, cancer therapy is not only going to impact her fertility, it is cancer as such per se that is also going to deteriorate the quality of the tissue, ovarian, any cell of her body which is dividing, and she has to undergo fertility preservation. Ovarian tissue cryopreservation is not anymore an experimental kind of therapy. It has proven its benefit in longer way, and plus many people who had, I think, 5 or 6 ovarian cryo tissue preservation babies have already been born, who were those tissues were preserved earlier and later on when implanted. And the best thing is these people, they did not have to undergo in vitro fertilization. And overall, the number I am missing right now, when they compared, the chances of getting normal pregnancy were better than undergoing in vitro fertilization. So
Um, I'm just going to
yes.
add a little story here. The first ever oocyte ovarian tissue preservation was reimplanted in the forearm under the skin, and they actually, the tissue lived, blood circulation established, and they actually saw a follicle developing underneath the skin surface. They had this bleb, and that is how they proved that the tissue will reimplant again, will take blood from wherever it is, and it will go on. So that was like the first ever reimplant that like, people had tried.
So, Dr. Raj, I have one question, that there's something called as ovarian transposition, right? Say, supposing you are giving, irradiating a certain area and the ovary is coming there. So what is actually what they do in it, and does it
So,
really? Hmm.
yeah, so basically what they do is, see, the main thing to understand with radiotherapy is that it is extremely focused. They decide on points, and the dose is given only at those points. Now, the ovary tends to be a mobile organ, right? So so if the ovary is mobile during radio, the ovary may sometimes come and lie in the path of the beam. So what they do is, before going ahead for radiotherapy, they would take the ovary, they would turn it in whatever direction. So जो भी point decide हुए हैं, they remove the ovary from that path and they take a tape and they fix it to maybe the fundus of the uterus, or sometimes they would even mobilize the pedicle and bring it up more abdominal, depending on what they're doing. And then they get the ovary
Or
out of the
they
way.
or they move the ovary laterally
So, yes,
into
so
the
either medial or lateral, depending on where they are focusing. So sometimes, they're like doing it for secondary nodes and stuff. In that case, we come medial. They want to do it for a central ratio, then you go lateral. So that is something that the radiologist would decide. But the principle is getting the ovary out of the direct beam of radiation. And
Yes.
the path in which we are going, we know the angle in which we are going. Ovary is normally a free organ because it's got a pedicle, तो वो move हो सकता है, move होके, and we also know कि जब ovary होता है, जब when the follicle grows, ovary जो side में रहते हैं, follicle के growth से center भी नीचे आ जाते हैं. Okay, so we know that there is a mobility there. तो ये मोबाइल ओवरी गलती से डैमेज ना हो जाए, इसीलिए just getting it out of the way of the chemotherapy, transposition. So transparent position. It's as simple as
Yes.
that.
So there
Yes.
is one point which I was going through is that they place the titanium clips next
Yes, to be
at
able
the
to
ovarian
identify where.
tubes
Shielding,
so that the
they
radiologist can identify those clips and try to avoid those areas when they are
Yes,
giving irradiating that area. It's very important to do that.
And the reason ovary is such a versatile organ, that if a young girl who's a teenager and she is undergoing any kind of chemo or radiotherapy, even by just giving her one GnRH analog, decapeptyl, triptorelin kind of injection to just postpone the growth for certain time, that also gives certain kind of prevention and protection. So when this girl grows up and she is out of this chemo and radiotherapy, she can regain her follicular genesis, and that leads to normal kind of. But there are two schools of thought, as people always believe that cancer per se gives bad oocyte quality, so preservation. But where you don't have time, these are the ways you can preserve your fertility. Coming to the
There's one
main.
more, Dr. Seema. One small point I would like to make is that when we transposition the ovaries, we have to remember, say later they go for an IVF, I mean, oocyte recovery. But to do an transabdominal oocyte recovery, you can't do it vaginally. So you have to keep that in mind.
And sometimes they just bring it back also by surgery, redoing the surgery. That is also the way for that. Coming to Arshi, like we have talked a lot about medical part of fertility preservation for the girls. Why should girls have all the fun? Let's go to jokes apart. Let's talk about the boys. Arshi, any male who is what are the indications where you feel they should be exploiting this concept of fertility preservation, and plus mention those diseases where it is mandatory and must.
So one we have already talked about is malignancies, where definitely the person is going for chemotherapy. So any tissue which is fast growing cells, so sperms are also fast growing cells. So definitely in case of malignancy, that is should be done, must be done. So that we are keeping apart. Plus, nowadays in this era, we have seen that the fertility is going quite down. Male factor is going down. So in the case where the males are very with the oligospermia, severe oligospermic males are there, and sometimes we are trying to find from PISA extracted sperms also. So preservation and even this testicular tissue preservation can also be done. So males with the malignancy can have testicular preservation also, with the semen preservation for patients who are having low sperm count, or who are at who are outside the country, or the males are they are going somewhere on their work. So in case they have to, the wife has to undergo these fertility treatments, then also they can preserve the semen. And in case uh, this is a choice, they can always preserve their semen in future if they require. And that is, even if the count is normal, then also they can preserve their semen. because this is a
And
mathematical.
Dr. Arshi, to preserve semen is very easy. It
It's
is
a
the
very easy
easiest,
process,
easiest
easiest
and
one,
cheapest. It's cheap. It's not as much as
very very
oocyte
reasonable costing. Yeah,
cryopreservation. So I think
comparative to.
yes, semen preservation is very easy, very inexpensive, technically not so very difficult. It should be done.
Raj, you are staying in Bombay, and Dr. Anuradha is staying in Bangalore. What is your perception? How are you looking at it, and what do you experience in your practice? How many males they are coming forward to freeze their sperm for future use? A friend of mine, he was talking about undergoing vasectomy, and before that, he froze sperms. So, how are things moving in our metros? If we are talking about India, what about all these indications like hypogonadotropic hypogonadism, people moving towards hypergonadotropic hypogonadism, or apart from the diseases, as Dr. Anuradha, you only earlier said, type 2 diabetes mellitus, where
Yeah.
the quality of sperm is going to be compromised severely. Are people coming forward to freeze their sperm? Or if you suggest someone, suppose someone is having a count of 5 to 8 millions, you have done his hormone levels, and you found that FSH is moving faster towards, like, as per Andrology Association of America, the recent cutoff for FSH, beyond that fertility has to be preserved because it is going to go further down, or almost stop, has become 7.5 million international units. So when you suggest your patient to freeze 3 4 samples, are they following it, and how frequently is it?
So I do have a few samples taken for men who had been diagnosed with certain cancers. So we do have a couple of Sweden oncologists around who report and have those samples taken. I have also had two or three patients being referred by diabetologists because they had started developing erectile dysfunction. And the diabetologist knew that the family is yet not complete. Literally one-on-one talking, had met them at a conference, had discussed this, they remembered it, and they sent the patient in. So the patients who are like really suffering badly, that even if they develop extreme ED, at least they have that psychological this thing that there is some sample frozen. So I have a few of those frozen. Obviously, when you get a patient of severe OS, you sit and you counsel. And in my experience, if you tell them exactly what is happening, explain to them the potential pitfalls in the future, and explain to them the benefits of trying to preserve fertility now, I have not had a single male patient say no to it. And you tell them to freeze two samples, five samples, six samples, they're absolutely okay with doing that. I also have couples coming in where the guy typically works in the army and therefore is going to be going off for a very long time. And I have had a few of those gentlemen come and freeze their samples, saying that, even if I'm not there, let the people continue. And I had one of them say, even if I'm not there and she wants to have a baby, please keep my samples. And we were like really touched to just listen to that. And obviously, we sort of ticked off the right box in the consent form, saying even in eventuality of death, allow my wife to use the sample. So I think awareness is slightly better probably in the metro cities, but it is not as good as I would want it to be.
What is your experience, Dr. Anuradha?
Yeah. So, what is happening is the percentage of people voluntarily coming to for freezing the semen sample is low. Okay, most of the times when they are trying for a baby and we are doing a semen analysis and we are catching that waxing waning counts or low counts, we are the ones who are generally advising them this, and then they do it. They are not reluctant, they do it. But I have seen very, very less. I would not even say 0.5%. No, very less than 0.5%. People, firstly, youngsters, they are not doing semen analysis only. Whether they are, getting married and all, no, no, they don't do. They never have done semen analysis. There are so many men, young men, who are going for marriage, but they've never done a semen analysis. They don't voluntarily come. So they're ignorant about it. They don't know about it, that this is something that we should do a semen analysis. Like we are spreading the awareness for doing an AMH in even younger women. So similarly, we have to spread the awareness for these young adult men also, that you can get a semen analysis done voluntarily. No one is going to stop you from doing that, so that we can catch it earlier and semen freezing can be done. But yes, whenever we find a problem, now here what we have, we are in the IT, we are the IT city of India. So we have more couples, the husband going offside to US, or abroad for long projects, say 2 years or 3 years, and the wife is having her job here. She's not able to go so frequently, maybe once in 6 months. There, yes, when we offer and they want to have a child, we do offer semen preservation, and we freeze it. And one good thing is, the people who are very educated, earlier, like I'll go into the social aspect of it. Earlier it was, Dr. Seema, you will agree with me that husband is outside, how can the wife get pregnant? It's a taboo. It used to be a
Yes,
taboo.
yes,
So
yes.
keeping that social aspect in mind, there are few couples who are hesitant. But now, the younger people, they are coming forward, and they are telling, even if we are not there, technology is there. We are going to explain to our family. They talk to the family, actually, both parents, the girl side and the husband side, and they tell them that we are freezing the semen, and she will undergo an IUI in my absence, and this will be my baby. So you're not going to, so under that, with the watchful this thing of parents and parents-in-law, yes, it is happening, and I'm happy about it. Okay, but
So
the
coming,
voluntary, yeah, the
yeah.
voluntary thing is still not so much. It should
So
improve.
yeah, so coming to tier three and four and two cities, and then I'll come to myself. What is your experience, Dr. Arshi, when you are telling your patient that he needs to freeze his semen? What is the response? How frequently they abide it, and what is your take on it?
Uh, Most of the time, when I advise them, when the males are outside the country or the city, and in few males we do regularly, when the cycles are taken, we feel we should have one preserved sample for IVF or ICSI patients on that day also fresh, but we usually freeze it. So when the thing come, when the patient comes by themselves for freezing, the first important thing is the charges. Still in India, charges are something, the first issue. Although we say it is not very expensive, but still the concept, where I am here in Rajasthan, here even this amount is too much for the patient. So they say कि it is, we'll think, we'll talk, and then we'll let you know. So if 10 patients are there, hardly two will turn up for freezing. The rest will definitely
I
think and
completely
tell.
agree with you. The same thing happens at my place, as Dr. Raj and Dr. Anu said. If we tell them properly, we counsel them, they agree to it. But the sick, that thing which is which should be immediate thing, kind of, yes, 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 since it is in danger, let's do it immediately. They will ask for the charges. Doctor, how much are you charging for semen freezing? Okay, let's go home, give me some medication, I'll come back and I'll do it. They do. But if you tell them to freeze five samples, they'll do one, that too, in longer span of time. And talking about that backup sample, I have to tell them repeatedly for IVF that that is for you. Even if you do it for free, please do. There are some recurring costs, but that is not as compared to as you losing your genetic material in certain span of time. Azamgarh being a money order economy, I agree to Anu. Earlier, this husband comes for a month. First of all, if they are coming for 2 months, they'll go to a doctor, they'll try normal fertility treatment. If it's not working, they come back to me. And if I offer them IVF, now I do freeze all cycles in most of the cases. So in freeze all cycle, husband is not going to be there, or if cycle fails, so second transfer, they will be saying, अरे मैडम, हम रहेंगे नहीं, आप कहाँ से बच्चा मेरी वाइफ को कर देंगे, ऐसा नहीं कर सकते हैं. Then they'll be coming back after 3 years. Minimum span is 2 to 3 years for this place. When people go to all these Middle East countries, they are coming back. But gradual change I have been noticing, these younger boys from same families, they say, ma'am, we are freezing. So though few of them will be like, please don't tell anyone, just do something like that. And I keep telling them, if your family is knowing, if you and your wife are clear about it, it shouldn't be an issue. So fertility preservation, and especially in Azamgarh earlier, though I used to treat, investigate the female partner completely. Male was never like, he never used to come in front of me. In certain cases, I found them azoospermic. Later on, till then, wife has undergone laparoscopy and everything. So imagine the reason, kind of this thing, not being aware about, as Dr. Anu said, what is the treatment,
See, I think we lost Dr. Seema. I think by the time it comes. So basically, the social implications are big in this freezing and husband being outside. We all agree to it. So there has to be a proper consent from the husband before he leaves. That, like we take for any IUI, that this baby is going to be the legal heir of us, of our family. So that consent forms are very important.
one's
if
whole basket?
if you forget to sign those consent forms, please do not do all these procedures.
Sorry, I lost the connectivity for some time. So this session has gone longer than we had expected. I think we should take, we should say it a day now, and let's get started with our 3 shots for the day. I'll start with Arshi today.
So my short is awareness. When you have any disease, please first of all find out, read about it, and then decide about it. Talk to the specialist or your concerned doctors. Secondly, right decision at right age. Even if you are not having any problem, go for social egg freezing and freezing of semen. Even though you don't require it, you never know what time will come and what time can cause. So it is always better to go for social egg freezing and this semen freezing. Thirdly, third shot I don't have. So third one I'll add later on. First of all, let's Raj do.
So my thoughts are actually for my colleagues. They are for my oncology colleagues and for my general physician colleagues and for my surgeon colleagues. Remember that beyond the disease that you're dealing with, there is a human being who needs to have a fulfilling life. And therefore, if you feel that either the disease process or your treatment is going to be affecting the person's life in the future, kindly please actually put the words fertility preservation in their head. That's the first shot. The second shot is, all of us IVF consultants are not going to delay your treatments. Okay, so if it's the guy you are referring, all you have to do is come for 1 hour and we sort him out. You can then continue with your treatment, what you need to do. Even if it's a lady, we have got something called as random start protocols, and we could get her free in as less as 10 to 11 days time. Okay, so your chemotherapies and your radiotherapies need not be postponed. and that might be balancing अपने तराजू के दोनों पलड़े आप किस तरह बैलेंस कर पाओगे. कैंसर की ट्रीटमेंट भी डिले नहीं होगी और उनकी फर्टिलिटी भी बनी रहेगी. दैट्स माय सेकंड शॉट फॉर माय कलीग्स. एंड माय थर्ड शॉट इज फॉर माय गायनेकोलॉजिकली. ओके, तो आपके पास जो पेशेंट्स आते हैं जिनको पीआईडी हो चुकी है, जिनको एंडोमेट्रियोसिस चल रहे हैं, जिनके पीसीओएस, सॉरी, जिनके लाइक पीसीओ पेशेंट डायबिटिक हो चुके हैं, इन सब पेशेंट्स से प्लीज जल्दी फर्टिलिटी की बातें करें. एंड प्लीज टेल देम दैट it might be a good idea to preserve something now instead of leaving it for too long. So these are my three thoughts and all three for my colleagues. Please look
Anu,
into it.
here I would like you to keep your thoughts in form of the overall gist of this fertility preservation things. What are the ways available? How can one avail that? And who are the candidates?
So for any fertility preservation, there is number one, oocyte preservation, sperm preservation, embryo cryopreservation, and even IVM. Certain centers who are well versed, they can do even with immature. When you have very less time for the therapy, you can take the immature oocytes and you can mature them. So that also is available. Only few centers do it, but it is there. Ovarian transposition we discussed in detail, that can be done. And another thing is there is a role of a limited role, I would say, but there is evidence on it. There's a Cochrane review, and there is a systemic review also on overprotectants. So GnRH analogs, they are seen to be overprotectant. So they say you should start 10 days before the therapy, cancer therapy, continue it for throughout and up to 20 days after the therapy. So that has a small role that can be given to certain patients. So this is the main thing which is available. But main thing I would say, counseling, counseling,
Testicular
counseling.
tissue preservation.
Yeah, ovarian tissue preservation. That's another one.
Testicular tissue.
Yes, can be
Test.
done.
See, and counseling, 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 mental health counselors, they, because see, when patient is diagnosed with cancer, it's very emotionally draining, very psychologically impacting. So counselors have to be there for them all the time. They have to explain. Half your job is done if you find a good counselor. So these things. Third, I would say the awareness, the spread. There should be fertility preservation support groups in the population to be done. NGOs can come forward, and people can also, a little bit donations. With donations, we can ask, like in my husband's hospital, Aster, if there is a poor patient coming, they have a big group of the richer patients coming getting well, and they want to donate to the hospital. So they have an donation program, their money donation program, which is used for people in need. So that
So
we can.
थैंक यू डियर. यहाँ मैं अपने हिंदी भाषी दर्शकों को बता दूं, अभी मैंने पिछले हफ्ते एक लाइव प्रोग्राम ऑलरेडी फर्टिलिटी प्रिजर्वेशन पे आपके लिए कर रखा है. तो आपको इन शॉर्ट आज हम जरा अपने डॉक्टर भाई बहनों के लिए भी ये प्रोग्राम कर रहे थे. तो हम आज फिर फर्टिलिटी प्रिजर्वेशन की बात कर रहे थे, जिसका मतलब होता है कि आपके अंडे और आपके शुक्राणुओं को किसी भी तरह से, या आपके अंडाशय और आपके टेस्टिस के पार्ट को हम किसी तरह से फ्रीज करके प्रिजर्व करके रखते हैं. यदि आप किसी आपातकालीन बीमारी के इलाज के लिए जा रहे हैं, अगर आपका एक्सीडेंट हो जाता है, आपके स्क्रोटम में चोट लग गई है, या आपको किसी तरह का, ईश्वर न करे, कभी कैंसर हो जाता है, वो ब्लड कैंसर हो सकता है, टेस्टिकुलर कैंसर हो सकता है, पेट का कैंसर हो सकता है, औरतों में सीए ब्रेस्ट, सीए यूट्रस, ओवरीज, सर्विक्स, ये सारे कैंसर्स है जो कॉमन है. इन सब के इलाज में आपको कीमोथेरेपी और रेडियोथेरेपी का यूज होता है. कैंसर पर से आपके शुक्राणु और अंडों की क्वालिटी को खराब करता है. अगर उसके ऊपर से आपको ये सारी दवाएं चल जाती हैं तो वो एकदम खत्म हो जाते हैं आपके बॉडी में, और रहते हैं तो किसी काम के नहीं होते हैं। तो इसलिए इन सभी जगहों पे, ईश्वर ना करे, मैंने बार बार बोला कि ऐसा किसी को हो, अगर होता है और आपके पास टाइम है, साइंस के माध्यम से हमने अपनी सर्वाइवल रेट बहुत अच्छी इंप्रूव कर ली है। मेरी एक पेशेंट सीए सर्विक्स की है, वो पिछले 20 सालों से मुझसे मिलने हर साल आती हैं, थैंक यू कहने कि उनको हम लोगों ने समय से डायग्नोज करके भेज दिया। तो आप सोच सकते हैं कि लाइफ स्पैन कितना बढ़िया है। तो अगर आपको मौका मिलता है, आपके फाइनेंसेस आपको अलाउ करते हैं, आप किसी तरह की हेल्प ले पाते हैं, तो आप अपना फर्टिलिटी प्रिजर्वेशन जरूर कराएं। वो किसी भी तरह से, अगर कुछ भी नहीं करा पा रहे हैं तो जिस इंजेक्शन की हमने बात की, लड़कियों को अगर हम वो इंजेक्शन दे देते हैं तो उससे भी काम चल जाता है। सीमेन में स्पर्म काउंट और स्पर्म की गतिशीलता या मोटिलिटी अगर कम हो रही है, आपका डॉक्टर आपसे कहता है कि आप अपने सीमेन सैंपल फ्रीज कर लीजिए, तो यकीन मानिए कि वो 3-4 हजार रुपए से कुछ भी उसका नहीं बनता बिगड़ता है। वो आपके जेनेटिक मटेरियल को प्रिजर्व करने के लिए होता है। उसके बहुत मिनिमल रिकरिंग चार्जेस लगते हैं पर ईयर, क्योंकि वो हमें एक डेटाबेस मेंटेन करना होता है और एक लिक्विड नाइट्रोजन में उसको 197 डिग्री सेंटीग्रेड माइनस पे रखना होता है। वो हमारी जिम्मेदारी हो जाती है, तो वो रखने में हमें उन चीजों का यूज करना पड़ता है। और जैसा मेरी दोस्तों ने कहा कि अवेयरनेस इज द की, आज आप इस प्रोग्राम को देख रहे हैं, अगर आपको हमारी ये बातें समझ में आई हैं और आपको लगता है कि कोई ऐसा व्यक्ति आपके आसपास है, उसके साथ अगर आप ये टॉपिक शेयर करते हैं, तो आप एक व्यक्ति की जिंदगी में इस तरह की खुशी ला पाएंगे। इस नोट के साथ आज हम विदा लेते हैं। Thank you, friends. Thanks for watching us and making us strive to do better for you all. Good night. Shabba khair. Take very good care of yourself.
I have one vote appeal. Day after tomorrow, the D-Day is coming. My dear Isarians, please vote for Dr. Seema Pandey as librarian for Librarian Isar, and myself, Dr. Anuradha Kar, for Member Managing Committee. We are, if you support us, we need your valuable vote. You please support us. And everyone has newer ideas which can be brought up into our societies, and I think we'll do a good job.
Thank you, Anu. Thank you so much. Yes, Arshi, you are muted.
So, my dear SRians, as rightly said by Dr. Anuradha, if we need a change and if we want to change these things also in system, so please, we need good, proper, and qualified leaders. And bestest what we can get is Dr. Seema Pandey and none other than Dr. Anuradha Khar. Thank you so much.
और
What
मेरे
we need is
दर्शकों,
what we need is we need leaders जो सबको साथ लेके चले। और सीमा और अनु ये बहुत
सबका
अच्छी
साथ
तरह
सबका
से
विकास।
अरे क्या बात बोली।
और मेरे दर्शकों, आपसे हमको प्रार्थना चाहिए, आप अपनी दुआओं में हमें याद रखिए और दुआ कीजिए कि हम जिस चीज के लिए आगे बढ़ रहे हैं उसमें हमारे को सफलता मिले। आपसे इतना, ये बहुत दुआओं में बहुत असर होता है, स्पेशली उनकी दुआओं में जो आपको प्यार करते हैं। तो शायद आपकी दुआएं हमारे साथ हो और हम वो कर गुजर जाए जिसकी हमने उम्मीद कर रखी है।
Thank you.
Thank you, everyone. Wonderful show. Thank you.
Shukriya. Shubh